Okay. Well, Cynthia, thanks so much for being here with me on our assessments today. So, as I say to everyone, my main goal is to be helpful for you, and whatever that sort of looks like, whether it's answering your questions or helping you go through an assessment, I'm here to be of assistance. So, tell me a little bit about what's going on with you and what can I do to be helpful.
All right. I was just, I'm not, I'm, if you could, I've seen assessments that you've done before and the person was on the machine.
Sure.
I'm not.
Okay.
And
That's okay.
okay.
So I think it's certainly, in order for us to do an assessment, we would very much need to have you on the Motus hand, or in the Motus hand rather.
Now, can I connect with you on on the notice?
So in terms of this call right now, this call, no.
Okay.
But if I don't know if you are, is it in a different room or what's?
No, it's right behind me.
Okay. Okay. Sure. Well, you could certainly go around and, well, maybe even before we do that,
Yeah,
what type of,
let's talk.
yeah, let's chat for a minute first. So tell me what's going on with you. What's going on in terms of any questions you have about it?
Um, I, I, I got it a couple, and I don't know exactly when.
Sure.
I didn't hook it up right away because I thought it was a little simpler than it was. I couldn't even open the box. So I was doing it for a few days, and a few things like I'm not good at reading directions and stuff, so I just was kind of figuring it out. And I started taking pictures of the screen because it would say you've done 1 day in a row or 2 days in a row when it had been 3 or 4. So I wanted to know how many hours, so I started taking pictures. And one day, I think it read less than it did the day before, and I did my hour and maybe hour and a half, and it had given me the first it was 10.15, and which was less than the day before. So I called and I had the technicians work with me, and after the unit rebooted, I started getting resistance, and where it says relax while I move your hand.
Mm-hmm.
Until this point, then all of a sudden it started moving my hand, and until that point, it never moved my hand before. I just thought, I just don't feel it.
Mm-hmm. Mm-hmm.
This is Katie calling me now.
That's okay. Sure.
I'll put her on speaker.
Is that Katie from Motus, Katie?
Notice, yeah. Hi,
Okay.
Katie.
Hey, Cynthia, is now a better time to give you a call back?
Well, I'm talking to Dr. Halsey right now.
Okay, great. Are you ready to get set up for your assessment with your Motus hand?
Am I Dr. Halsey?
So
We're still talking.
So you can let Katie know that I'll handle it, but I appreciate Katie being on the spot there and helping you. So I think, Katie, we're good for right now. I think we can handle the setup today.
Oh, okay. I can hear you, Dr. Housley. Thank you very much.
Okay, very good. Yeah, no worries. Thanks so much, Katie.
Thanks so much, Katie.
You're welcome. All right, you enjoy it, Cynthia.
I
Bye-bye.
will. Thank you. Bye-bye. She's been amazing. I love her.
Katie's great. Yep.
Yeah. I forget where we were. So then after that happened, it started to move. So I did get in touch with the tech from your company.
Okay.
And then I worked with her for a while. She adjusted the machine.
Okay.
And so it's been a few days.
Sure.
Yeah, it's
Okay.
a lot different now.
Yeah. No, I appreciate you acknowledging that too. I think, there is certainly a learning curve with respect to it. It does seem simple, but there's always more than meets the eye, isn't there, Cynthia?
I think I'm cognitively back, but I'm really not.
Sure. That's quite all right. And I think you let me know too if you need me to repeat anything. I know I have a tendency to talk too quickly. If you're having
I
trouble.
used to.
Fair enough. Okay. Well, I'll try to be cognizant of that, and you let me know if I need to repeat anything to help out. Okay. So I just looked at your prescription. It looks like we have, let's see, looks like it's scheduled for 126 minutes.
That's a lot.
Sure. Sure. Yeah. And of course, Cynthia, we can modify things too, right?
That's okay. Cause is it okay to skip certain games? You can see I've done that. Well, no, I haven't. I didn't even space shooter. I've done.
Yeah. So Cynthia, I'm not one to call people out for any reason other than to make sure that you're getting the best rehab possible.
No, I want you to call me out if it's supposed to be done a certain way. Go ahead.
I will certainly do that, Cynthia, but I will do it with a smile and without judgment, right? It is really it's really just to be helpful. Okay. So what I think can be helpful is, you said there were some of the games were they making sense for you, or were some of them a bit more challenging? Talking about those experiences so far.
For instance, Starman.
Yep.
I thought I did the tutorial there. Maybe I didn't do it on that one. You go down when the hour goes down, and you go up when the hour goes up. So I would go up to where it was comfortable, and I would just stay there, not realizing I had to go up until it pinged, and then go down again. So that took me a couple of days. I think,
and I think we're trying to improve that as well, right? So this feedback is really good. So don't ever feel like you have to pull a punch with me when it comes to something doesn't make sense.
And the one card game, the one where there's different colors and different numbers and
countdown.
I don't know what the circle means, and I play it, but I'm really not. I'm getting there, but
sure. Well, we can do this, Cynthia. I don't know if, and this of course does not have to be our only time together too. We can also work together in the future. Don't feel obliged that we have to get everything out and figured out right now. But what I want to do is I want to figure out maybe what's the biggest impediment to you working. So I think that would be, let's find those big issues and let's address them today. And then we can circle back around and start to address some of the more subtle things. So let me know.
The biggest impediment is when I'll be playing a game, or I'll go, and all of a sudden it feels good. Like I have to. There's some resistance, and then all of a sudden I can't get it to go up or down, or usually. It changes, it varies.
Sure.
All of a sudden, the resistance is so much I can't. And I push, and then I get fatigued. And yesterday I was doing something. Yesterday I had time. I could, I did almost an hour, and then I came back. I got fatigued. I came back and I did another some minutes. And I came back a third time and just did a few. But I was going along, fat, dumb, and happy. And all of a sudden, whoa, I couldn't do it anymore. And I guess part of it is my fatigue, but part of it is like, I just couldn't, all of a sudden, it was just like, so I don't know if that's me or if the resistance gets too much. Does the machine kind of feel if the machine thinks it's too easy for me, it gets more resistance?
So yes, it's a good insight that you have there. And so I think to be completely honest, Cynthia, it's going to be really hard for me to say definitively that it's one of these specific things. I think it could be very much a combination of them. So you can imagine too that if the Motus hand is trying to modify something to make it harder for you, that could kind of intersect with a potential bit of fatigue there, and you could have a situation where it feels very, very much more difficult to complete a task. Exactly. Yep. So one thing I would encourage you, if you are you mentioned it a couple of times now, and so I want to sort of resonate on that and let you know I'm hearing you. If if you do experience that you're having some significant fatigue, even so far as that you can feel like, hey, I'm actually getting pretty tired from this, I think it's a better choice to take a break, physically pause the screen, and give yourself a time to recover a little bit. I think that can be a good strategy. The main reason is if you don't do that, you might find yourself operating under sort of less ideal conditions, you yourself. And yeah, and that might mean that we're getting kind of less, in terms of like an investment type of idea, we might be getting less kind of return on our investment for your time. And I want you to get as much out of this as possible for a given unit of time.
I don't always have the option of coming back.
Understood. Okay. Well,
and also at the end of the day, it's what I can usually do, except on the weekends.
Sure.
If I stop, that's it. I'm not coming back.
Okay.
On the weekends I can.
Sure. Well, even a 30-second rest where if you just pause the screen, if you just touch it anywhere, it will pause.
Yeah.
And so you can just pause it and take a 30-second, 1-minute breather and get back into it. That might even be sufficient to allow yourself to get some recovery in there. Again, those are just some tips that you could try to test out for yourself. But now those tips won't replace a good assessment and games that are tailored for you. So I think those steps need to be taken. And then those sort of things about refining the rest periods and these sort of things can be a bit maybe second thoughts. But I think
I knowing my personality, if I let myself rest, I get lazy.
Sure. No, that's good that you know yourself. And I think it's always good if we can be honest with ourselves. And if, for me personally, I'll expose something here. I freaking love chocolate, right? And the way to keep me from eating too much chocolate is I don't have it in the house, right? There's a big barrier for me to eat chocolate, right? So I think if we can engineer these sort of things around, I think that might be helpful. So what we can do is maybe we can modify some of the activities, modify some of the prescriptions such that you won't have to do those things. You won't have to find yourself in that predicament where you have to make the choice of, do I need to, can I really stop here or not? So I don't know if you're available to try to put it on right now, but we could certainly do that.
Can we, it's right behind me.
That's quite all right.
I don't know if I can then see you when I'm on my machine.
Okay.
My husband went out in the yard.
Are we talking on a laptop right now?
Yes.
Okay.
One challenge I've had, that's what took me so long to really get into the program, is I don't know how to surface in my house where I can hang my hand, not right hand.
Sure.
And so I've got this crazy setup over here. I have all kinds of chairs here trying to pillows to make it ergonomic. I'm using the Motus box to hang my hand over.
Well, Cynthia, did you find out that if did you look into using the actual foam itself on your lap?
It's too long for any chair I have.
It is? Okay.
If I do it it's way too long to do it that way, to do it this way. Now, do it across my lap, I find I don't really get a good
movement.
Yeah.
Okay. We could kind of think through some of those things as well too.
When I get tired, I do that. I'll go this way, and I get a little bit more angle out of it.
Sure.
When I finish that solitaire game, I'll just do anything I can.
Yeah, very good. Well, let's go ahead and try to get set up here. And first things first, I don't know if it's powered on right now, but let's go ahead and try to get it powered up, and that way you and I can work together.
Yeah, I did turn it on before I sat down.
Okay.
I think once I get back there.
And so, Cynthia, do you have a good setup process for you? Do you kind of know how to put it on and all that good stuff?
Yeah, I can pretty much get that.
Okay.
Should I try to get the laptop closer to me, or are we good here?
I think, Cynthia, the one thing I would mention, I don't know if the laptop, the actual screen could be tilted towards you. That could be, I think the position is not too bad. It's just, it maybe needs to be tilted down a little bit. That way I can see. Yeah, maybe a touch more. Oh, that could be good right about there, Cynthia. That's pretty good. Oh yeah, that's not bad, Cynthia.
You can see me?
Yeah, I can see you at least. That's good.
I can see you. You're little, but I got
Okay.
my glasses on.
Okay.
So, I'm sometimes I feel like my hand is slipping out, and it'll be fine at first,
Mm-hmm.
and then all of a sudden it feels like my hand is slipping.
Okay. Okay.
But
Now,
I don't know if it's me or
So Cynthia, are you using the standard hand interface right now with Velcro on top?
yeah.
Okay, very good. Now, once you get that put on,
I've been working. It's just, I have to say this before, because I might forget and I'll be mad at myself.
Sure.
Since I've been using the Motus, one of the things I really want to do is write. And I used to practice in the beginning. I had this joke in 2018 in September.
Okay.
And I even made myself little tracing, I came out of preschool. I was a preschool person.
Okay.
I made myself some sheets to try to write, and I got so frustrated and so depressed that I stopped trying. And then I would, every once in a while, if I wrote really, really tiny, I could write a word.
Mm-hmm.
Just today, I wrote legibly. I could understand it. It was really amazing.
That's awesome. That's better than me on most days, Cynthia. Let's put it that way. My handwriting is atrocious, so.
I had really nice writing, but just to be able to write legibly, So
yeah, well, Cynthia, I would actually really encourage you, whenever I'm working with someone in terms of like one-on-one, if I was acting as their therapist, I would very much encourage you to integrate that into your sort of plan of care for yourself. So what I would do, and this is straight out of my sort of Nick's bag of treatment approaches, I would be using the Motus hand for around an hour a day with individuals. And then I would transition immediately into a functional task of your choice. And for you, that could be going straight into doing some writing samples, right? Just try to write maybe a sentence or two.
I feel like when I finally give up, of course I want to get my 30 hours, so I'm a maniac. I go to till I can't go anymore. And I guess I could try.
Yeah, and the reason I think that's good is because what happens when you're using and you're doing a lot of these movements, you're activating those circuits, right? And you're activating them to do these sort of gross motor things. And you can imagine it kind of like priming this system up, right? We're priming your nervous system. And we want to kind of capitalize that time when you're all kind of jazzed up and you're good to go. Yeah, you may have some fatigue. That's okay. But I think if you can try immediately to try to translate that to something that's really functional for you, that could be really good. And then that will also be interesting because then now you have an objective kind of readout. You can try to write maybe a simple sentence and then date it. And then you can track that over time. And that will help with writing, not only, try some of it in cursive, try some of it in block text, whatever you think.
Right. Mm-hmm. That's one thing I found, that one day I can write, the next day I look like it's 29 again.
Sure. And then what you'll start to do is you'll start to realize maybe what else is contributing to that, right? Maybe it's something with sleep.
I've tried to figure it out.
Yeah.
Some days, sure, I didn't get enough sleep, or I didn't have good enough sleep, or I had a glass of wine or two. And, other days there was absolutely no rhyme or reason. Sure.
And that's okay too, right? It is important to recognize that it's not always a straight linear path to improvement, right?
That's been a hard one for me to
Yep.
swallow.
It is a messy journey, the path of neuro recovery. And I think just acknowledging that and giving yourself a bit of leeway to realize that, hey, yeah, some days are not going to be as good as the day before. But That's why I like to talk about it in terms of trends. So that's why it's useful to have kind of a date and kind of a sample, because that way you can kind of plot, on average, we should be improving. But on that general trend, there might be some sort of deviations up and down, and that's expected.
It took a long time for me to accept that.
Yep.
That's why I was telling Katie, I was at a place where it's borderline fighting depression because it was like, come on. I was like, I don't know what else to do. I've done what I can. And that's when I don't even know how I came about finding Motus. And that's, I called her and was like, oh my gosh, I get this renewed.
Well, I'm really glad you got it. So why don't we get into it here? I've got a couple other guests that I get to before our end of our session today. But before I go on, let's actually go through and look at the numbers really quickly. Let's see what's going on with you. So what do you see on your screen right now?
Begin therapy.
Okay. On the left-hand side, could you go ahead and hit the telehealth button for me?
Okay.
Great. And then please press the assessment button.
Okay.
Okay. And then let me know, you'll see a couple of things. I don't know if this is your first time on this screen, but you'll see a couple of things on the left-hand side there. What do you see on the left-hand side? It should be a number.
minus 22.19.
Great.
It's changing.
Very good. Yeah. And so just to give you a sense of scope, that is the number that is your angle of your movement right now. Okay. So negatives are not bad. All those just mean that we're in flexion. So whenever this is 0 degrees here, anything below that is flexion.
Anything above that, flexion, yes.
Yep. Yep. And anything above that is we're in extension. So I'm just going to take a quick look at what type of ranges of motion we have here, and then we'll go on. Right now, Cynthia, do you have any sort of pain in that left arm at all? Or in your right arm, rather?
No.
Okay. Very good. So what we'll do now is I'm going to have you just try your best. Let me see if I can get this coming in here. Very good. I'm going to have you go ahead and move up as far as you can into extension. Just move as much as you can. And there's no right or wrong answer. Just do the best you can.
Now, is it okay for me to touch this because it's very long on my arm?
Sure. It's certainly okay if you brace. It's certainly not okay if you are helping with helping move it up. We don't want to do that.
That I know I'm absolutely doing, but this I'll go like.
Okay.
To keep it more flat.
That's fine. That's totally fine. So we'll do it again. So I'm going to have you go up and down a couple of times here just to make sure things are going well. So let's go ahead and have you move up as far as you can. Ooh, great. Very good. Very good. And I'm going to have you, from here, I'm going to have you move down into flexion as far as you can go. So Cynthia, that's really good. So you could see that you clearly got past neutral and you got up to around 22.6 degrees of extension. So I'd call that around, well, very near 45 or 50 degrees of total movement capabilities. That's pretty good, active movement. Now, the next thing we want to do is figure out what's going on with your passive range. So let's go ahead and check that out real quick. I want you to just, for the next couple of seconds, I'd like you to close your eyes, and I'm going to actually move the Motus hand slightly. And as soon as you feel it move you for the very first time, I'd like you to tell me that, hey, Nick, it's moving, okay? Don't rely on the sound because the sound's going to make it easy to know. And I might actually kind of try to trick you by not putting enough pressure in there to make it move. So you let me know as soon as you feel it move you. You can probably hear that kick on. And just do your best to tell me as soon as you feel it move you.
There you go.
Very good. Okay. Pretty good discrimination in there, Cynthia. You can go ahead and open up your eyes. I call that less than a degree. We're probably about half a degree of movement it took for you to detect that. So that's pretty good. The rest of this, we're going to have you just relax and let me know as soon as you feel any sort of stretch in your muscles. Okay. None of this should be uncomfortable. In your hand. Yeah, in your hand or in your muscles down here. Either way, you let me know as soon as it becomes a stretch. You still doing okay?
Yeah. Okay.
Okay.
That feels really good, actually, too.
Okay. So it's not uncomfortable. Is that what you're saying?
Not at all. It feels good to have my hand move.
Yep.
Without me straining to do it.
Sure. Pretty good movement here. Yep. Very good. So we're almost there. So you see that on the left-hand side, we're almost to 50 degrees on the left-hand side there. Go up a bit more. Now what I'd like to do is I'm going to take out all the assistance out of it. And as the assistance drops out of it, I like you to move down into flexion as far as you can. Great. Go as far down as you can go for me.
Yeah, that's about it.
Okay, great. And that is basically as far down as it will go. So whenever you see minus 25 there, that's the end of the limits. So you're already at the end range there. Very good. Okay. So now we're going to make a couple of modifications here. I'm going to change something. Let's go here. I'm going to put a little bit of assistance back in. Okay. We'll wait for that to catch up. And as soon as it pumps up to a little bit, we're going to go about 40. You should see that 40 in the center there.
Okay.
And then I'd like you from here to go up as far as you can into extension. Go up as far as you can, and feel free to hold on to the back of that to brace for me. We'll have you go up and up and up. Ooh, great. Very, very good.
You know what, Nick? I don't think I tightened this. Wait a minute.
Okay, that's okay.
That's another thing.
Sure.
I'm overlapping the flaps here.
Sure. I think that's one thing too. Especially if you're being very effortful, you got to make sure, do a quick check to make sure all your straps are battened down, if you will. Yeah, very good. Okay. And then go ahead and go down into flexion as far as you can for me. And is that pretty hard?
Yeah.
Okay. Have you go down as far as you can. Great. Very, very good. So, Cynthia, I already know we're going to make some significant changes here to your ranges of motion. Well, what I like to do is I like to be more, I would very much like to have much more tailored games for you, simply because you do have some good movement. I'm going to change the ranges of motion slightly. But I think making the games, well, I think I'm going to reduce the total time, but I'm going to make a selection of games that are a bit more challenging. So I think that would be helpful for you, such that it's hopefully going to not be so burdensome, but we're going to get more out of it.
There's a couple of games I really like, and the ones that were more like video games, at first I liked it.
Okay.
I back when I was in my 20, 30, late 20s, early 30s, and they came out. I never played them because they frustrated me. Like,
sure.
At first it seemed like okay, then I'd get flustered.
Sure. Well, which ones? Let me put it this way: which ones do you not like so much?
Well, so far what I play, I don't like the pets.
You don't like what?
Pets, Motus Pets.
Pets. Okay, that's coming off.
I can't remember the games right now.
How about Plinko? Okay. I'm going to talk about the ones that I think I would take out of your prescription. I'm actually going to take out Countdown too.
Countdown?
That's the one with the different card games with the different colors and shapes.
Okay. I could take or leave that. I don't like the fishing game.
You don't? Okay.
No.
I see. The thing is, I like the fishing game for you, but we'll start by taking that guy off. I'm actually going to, do you like Motus cards?
Well, you know what? I haven't played it since we've changed everything. Maybe I should try it again.
Okay.
Because I did the fishing when I guess I don't know what happened. I wasn't getting any assistance.
Okay. Yeah. Well, let's do this. I'm going to make these adjustments here. I'm going to add in. So Motus Pets is gone. I'm going to add in Motus Carts. Actually, no, you already have Motus Carts on.
I haven't played it yet though.
Okay.
It kind of
So,
gets, I like solitaire and I have a tendency to keep all the stuff I like. So
okay. Well, I didn't make any changes to the ones you like, so those are still there. But let's do this. I'm going to have you actually go hit the back button in the top left for me.
I don't like the strongman where it lifts up, just lifts up.
Okay, that one's gone. Strongman up is gone for you.
Okay, I don't like him at all.
Okay. Okay, now I'd like you to hit the back button for me. And I'm actually going to have you go through some of the activities. Okay. But before you do that, let's have you go ahead and hit the back button once. And I'd like you to start the meeting for me.
Start the meeting? Oh,
yes, please. Okay. And then you should see a toggle to share screen potentially once that loads up.
Toggle sharing screen.
Great. Great. Okay. Maybe press it one more time for me. And if that doesn't work, there should be a little bit of a gray icon right there in the left-hand side. You see kind of like a little person, an amorphous person. Go ahead and press that little person and then try to press the toggle to share screen one more time.
On the right-hand side.
Or left-hand side, sorry. There we go, perfect. And then go ahead and hit the white part of the screen, just anywhere above the assessment button, just once. Great, and then you can go home, and I'd like you to begin your therapy. Okay, so what I'm gonna have you do is I'm gonna have you actually go through and play some of these individual games. I'm gonna jump over to my next guest really quickly, and I'm gonna be watching the games, and then I'll touch base with you as soon as, before we end, to make sure things are working well, okay?
Okay.
Very good. Okie dokie, very good. So I'm going to go over to my next guest really quickly. I'm going to go over to John. John, are you there? And John, you might be muted, so let me know if you can hear me. See if you can maybe unmute yourself.
I can talk, Nick, now. Can you hear me?
Yes, John, I can hear you just fine. Can you hear me?
Yes, I can.
Very good. Thanks so much for being here with me.
I don't have my screen. I don't have my screen available, and I don't have my handpiece. I'm strictly on the phone call.
That's quite all right, John.
I got a problem with my hand device.
Okay.
I'm waiting for a new one to be sent, and at which time I will call you for a tightening up of my devices, But
yes.
I'm really interested in how do you feel about Botox?
Good question, John.
Question.
Yeah, good question. So let me first say, I'm sorry that you're having some trouble with the system, and I think
that's all right.
Yeah.
Hey,
as soon as we get you a new one, we'll jump on a call together and we'll tighten things up and we'll get that assessment done. So don't worry, we'll make sure to get that done.
Oh, I'm not.
Okay, very good. But with regard to your question with Botox, it's an important one, and I always like to talk about things from the evidence perspective. And in terms of in medicine, there are these things called sort of standards of care and these things called clinical practice guidelines. These are the things that physicians and doctors, we use to help guide the way we treat our patients. And with respect to individuals who've had neurologic injuries, something like a stroke or a traumatic brain injury, when you look at the best practices, sort of the gold standard, the recommendations very much call for an approach that involves multimodal therapies, multimodal treatments. And they explicitly call out treatments that use these pharmacologic aids to help reduce spasticity and tone, in addition to these high-dose repetitive task practice-like programs, something like you would get with the Motus hand. So these two things work very well together and actually have amplified efficacy when you put them together. And that makes sense, mainly because when you think about how Botox or something like potentially like baclofen, another type of anti-spasticity or anti-hypertonicity drug, these things help to actually alleviate that tone that causes that hypertonicity or that spasticity that causes you to have difficulty moving. And when you have increased capacity to practice in ranges of motion, then those therapies, those motor-based therapies that you do, like this repetitive task practice, can be better, sort of more effective. So I think very much they go kind of hand in hand.
I'm going to see a hand specialist I'm going to talk to a hand specialist on Friday. And I just wanted to get your take on it before I, listen to what she had to say,
Sure,
But
sure.
I would a hand doctor recommend the Botox?
I think this, again, it's a great question about whether or not a hand doctor, sort of a hand specialist, might sort of suggest this or recommend this. I think it's very much based on your past medical history, as well as their.
And I have a history with them. So
Okay, and also their evaluation of you when they work with you in person. A lot of that process is designed to identify if there are specific muscle groups that should be targeted, right? One of the nice things about Botox, as compared to something like an oral drug, something like a baclofen, Botox can be delivered in a very targeted fashion. So if you have, for instance, in your arm and your hand, some specific sort of culprits that are causing problems for you, they can deliver very specifically those agents to help alleviate that spasticity and hypertonicity. So it's going to be based off of their sort of evaluation of what they think is going on with the muscles. And I think specifically hand specialists, whether it's an orthopedic specialist, they will work along with PM&R docs or physical medicine or rehabilitation doctors, as well as neurologists, to kind of figure out the best course of that. The one thing I'm going to mention, though, John, is that make sure you ask them about specific timing of, let's say, for instance, you do go down the path and get some Botox injections. Make sure you clarify with them when it's okay for you to start your movement programs again, your rehab again. Different physicians will have different sort of protocols for when that needs to start, because it can generally take a couple of days for the Botox to take effect. And then there's a window of time, sort of peaks around a couple of weeks and then lasts for maybe 3 or 4 months after that. And so we really need to focus on that time window when you have kind of the most capabilities. So just make sure you clarify that with them.
Okay. Thank you, doctor.
Yeah, of course. Yeah, I think I get the question a lot in terms of whether or not Botox and these sort of robotic-based approaches are compatible, and I think very much so. That's one of the nice things about movement-based approaches, is that they do work with very many types of complementary approaches, and it's really nice that there's the evidence that says that they do work kind of synergistically together. And so, John, I don't know if you'd be interested in this. I'd be happy to send you those resources so you can be informed as well. You don't have to just take my word for it. You can look at those resources too.
Okay. You'll send them to me?
Yes, we can certainly do that. I believe we have an email for you potentially. And
yes,
we can,
you do.
Yeah, and we can I'll send you an email with those resources.
Okay, thanks.
Yeah, of course. John, any other questions?
No.
Okay.
I've been doing it. Well, you know what? During the evaluation and the typing up, I'll have my other questions answered. Okay.
Okay. Very good.
No sense tying up now.
No worries, John. I appreciate it, and I look forward to working with you in the very near future.
Okay. Thank you, Doc.
Okay. Bye, John. Okay, I'm going to go back over quickly to Cynthia and see how things are going. So, Cynthia, can you hear me? Okay, actually, Cynthia, it looks like we got muted again. That's okay. I'll see if we can unmute you here. Let's see. Actually, Cynthia, I do see that you are actually playing, so maybe we can have someone in your house maybe try to unmute the laptop so we can work together. Okay, very good, Cynthia. I can see that you're playing. So actually, I think give me maybe with your left hand. Give me a thumbs up, thumbs down. What are your thoughts so far? Thumbs up. Okay, okay, very good. I've been watching the data come in, and it looks pretty good, I'd say. Pretty happy with those numbers, Cynthia.
Okay.
Excellent, very good. Sorry about that, Cynthia. Yeah, I'm really happy with the way that progress is looking for you and those ranges of motion. Yeah,
It feels good, and
Okay.
I don't feel too strained.
Good, good. Yeah, it is designed to help you with those components, right? It is designed to help compensate a little bit for whenever you do have that fatigue. But I'm not seeing any evidence of that fatigue right now. Your ranges of motion are holding nice and steady.
It's early yet.
What's that?
It's early yet.
Okay. Sure. I will update my inference as soon as we see any evidence of that. But at present, I'm really happy with the way it's looking. Now this is the real telltale one, Cynthia. So we'll get into this one here. Let's see what's going on.
Okay.
So first things first, let's have you move all the way to the right-hand side of the screen if you can. Beautiful, very good. All the way to the left for me. Great. Okay, no, that's really good. That's really good.
Yeah, it's like in the beginning of this game, I seemed to do okay, and then it's like crazy.
Well, Cynthia, this is when I think it's good for us to use that strategy of pausing the game. I think we need to be okay with that. So whenever you find that especially when you're having trouble going to the left-hand side, Cynthia,
I think you're right.
Take a break. Touch the screen, pause it. That's totally fine.
Oh, I thought you wanted me to do it now.
No, sure. Well, no, it's good practice. It's good practice. So I'd say it's a good habit to get into. To give yourself that kind of level of comfort that, hey, it's okay. I'm going to pause it, give myself 30 seconds, and get back into it.
I think that's important because when I start getting used to the game, and I'm doing it well, and all of a sudden, boom.
Yep.
It'll hit a saturation point, if you will.
Yep, it'll hit you like a ton of bricks. Yeah, and I think it's good. We have to kind of understand kind of our internal signals a little bit too, right?
It's hard to accept that, you know.
Yep. No.
I should be used to it by now.
And again, like I said, Cynthia, there's no judgment here. We just need to figure out what's the best thing for you. And so with respect to understanding when is that point, because we don't want to get to that saturation point. We want to stop a little bit before that, but not too much farther before that. So we got to kind of test a little bit. Well, okay, what is that? Is it kind of I'm feeling the burn or what is it? And unfortunately, I can't answer that for you. But what we can do together is we can maybe just play a little bit here, and I can watch as those sort of numbers change a little bit. And maybe you can kind of, when I'm seeing the objective data that, hey, maybe it's time to pause, maybe you can take a quick snapshot of what you're feeling in your hand and your arm and your brain about what might be the cue for you as what would be a good pausing, sort of resting point. Okay.
And I found myself getting confused too. Well, I meant to go right, I went left too.
Sure.
And then went that thing.
Yep. Good.
That's another thing. At first, I didn't know what was those little things were killing me.
Oh yes, Yeah, I think that's also the fun of it too, right? That part of learning is really useful in terms of trying to do that self-exploration and all those elements. Pretty important for the learning process. So I don't see a problem there in the fact that you had to kind of
That's true.
a bit of trial by fire, or in this case, trial by spaceship death.
Yeah. They killed the area.
That's very good.
They're doing it.
So Cynthia, are you feeling it's a bit harder to get over to the left-hand side now?
Yes.
Yeah. So right now, pause the screen. Just give yourself a second pause and just count it down. Give yourself 30 seconds a minute. And I was looking at the data and I was seeing that we were kind of trending towards a little bit less range of motion. So whenever you're feeling that kind of sensation, whatever it is for you, just acknowledge that. It's okay. Pause the game. Give yourself 30 seconds to get back into it.
That's where the brain's starting. I'm starting to see the deficit in the brain that, like, oh yeah, I can't I? Instead of just doing it, I fight it.
Yep. Yeah. And I think that's also another really important thing too to mention as well, is that while we're also working on our movements, that's kind of our primary thing, getting back those sensory motor functions, but it's also the sort of executive functions in recognizing, hey, this is, I do have a limit. I am a person. I do have my limits, and let's try to understand where those things are. So it's a good thing to practice as well.
Yes, yeah. I'm seeing where I really have to acknowledge that.
Yeah.
I'm stubborn. I don't want to.
Yep. Very much resonate with that. Very much resonate. And so you can see even just that subtle 30-second, 45-second break, able to get over
It's
there.
getting harder now too,
Yeah, sure. And that's okay. Hard is okay.
Just because that's the game.
Yep.
Nature of the game.
Yep, exactly. Okay, Cynthia, well, I'm going to do something real quick. I think we've learned a lot here. We've made some nice changes.
Yeah.
I'm happy with this. And I think we should actually go ahead and touch base in maybe a week or so to make sure progress is still going on. But I'm going to take a quick break here for a second. I'm going to get ready for my formal Rehab Power Hour. And so I would very much encourage you to stick around, and we can continue
potentially. I can watch on the computer?
Yes, you can. Yep.
That'd be great, because it's a lot better than my phone.
Sure. Yeah, I think it should be live on the Facebook group, and we'll be going live, like I said, about 5 minutes or so. But I'm going to take a quick break, and I will be back momentarily. Okay.
Okay. Thank you so much.
Sure. Of course, Cynthia.
Before you go.
Sure.
You mentioned a couple. I don't know when, but you mentioned when you walk around the house and but you can't do it somewhere else.
Yeah.
What's that called?
Oh, yeah. Are you talking about like the gait classifications, where you were a home ambulator versus a limited community ambulator?
Yes.
Yeah. This is a way that there's outcome measures. They're scientific tools. They're basically like, tools we use to measure things in science. In this case, we use them to measure gait speed. And gait speed, there's actually a classification. So if you can walk above certain number of meters a second, sort of a speed, you are considered what's called a limited community ambulator. This means that you can walk around in the community with some assistance, with some modifications. And then once you go above a certain velocity, then you can walk sort of unencumbered, or you're believed to be able to walk unencumbered in the community. And so those gait speeds, this is why we focus on gait speed, Cynthia, is because it's such a good predictor of safety and dynamic balance support. So that's one of the reasons why we focus on this. So if you have go ahead.
That's when the Motus foot would come in.
Yeah, exactly. That was one of the primary outcome measures we used with the Motus foot in those big clinical studies. Yep.
You don't have any more spots for the beta testing, do you?
I have to check. Unfortunately, I don't know those numbers right now, but certainly we can.
I'll take your whole break if you let me go.
That's okay. Okay, thank you. All right, I'll be right back, Cynthia.
Yeah.